This week on the St. Paul Forum, I'm talking with Tim Thorpe and Maureen Bazinet Beck about Pathways, a healing resource center in South Minneapolis. That's this week on the St. Paul Forum. Welcome to the St. Paul Forum. I'm Catherine Day, and joining me today are Tim Thorpe and Maureen Bazinet Beck of Pathways, which is a healing resource center in South Minneapolis. Welcome.
Thank you.
Thank you so much for being here. Tim, you're the executive director of Pathways, which has been in our community for how long now?
Almost 25 years.
Wow. And it's a healing resource center in South Minneapolis.
Yes, we're a healing resource center that offers services on site for those in life-threatening or severe chronic illness.
Right. And I know you've been the executive director there for a while, but could you just tell us briefly, you've been, how did you get to Pathways?
Sure. I was in the for-profit sector for a long time, providing strategic business planning for a variety of clients, but was always sort of philanthropically engaged in various service environments. And the former executive director for Pathways had retired, and Pathways was looking to replace their executive director, and fortunately the two organizations and myself met, and they chose to hire me, so I'm very fortunate to have been brought on.
So Maureen, how did you get involved with the board at Pathways?
Well, because my background's in education, it was sort of a leap to go to complementary care. But Mike and Penny Winton were friends, and Mike at the time was very ill and trying to put his life in order. One of the things important to Mike and Penny was making sure that that Pathways and the board stayed healthy and strong. So Mike approached me over lunch and said, would you be willing to be on the board? Initially I said, gee, Mike, I'm on too many boards right now, it's not going to work. But 6 months later, when he asked again, how could you, if you knew Mike Winton, you wouldn't refuse him. And as it's turned out, you know, that was 5 years ago, actually, and it's been just really a wonderful
Well, and
thing
it
for
seems
me.
to me that he had said to you something about that they really wanted he wanted some new energy. He wanted your energy.
Well, I think that because of the way the board was set up initially, and because the Wintons were there wasn't a need to have a board that had lots of board experience. And he knew that I'd been on other boards, that I was involved in a family foundation, and I had some experience with it. So I think he thought it was important that there be people taking care of Pathways when he was gone.
And kind of setting up this important transition, which in the life of any nonprofit, the transition
Correct.
from the founder to the next phase is always one of the most important transitions in the life of an institution.
Exactly, and he knew it was going to be, it's always a difficult one too.
Yeah.
It's not easy. So.
I'd like for you to tell us, Tim, just a little bit about the purpose behind Pathways and how it came to be, because the story of the organization is really pretty extraordinary. It's a pioneering organization that not everyone understands where it came from or how powerful it really is.
Okay. Well, at the time Pathways was founded, Mike and Penny, the founders, were out in California. Mike then had a life-threatening blood cancer and was in primary care, started dabbling in and experimenting with various complementary therapies such as yoga and nutrition and exercise, and started feeling better. He wasn't assigning the improvement in health to either the complementary therapies or the primary care. But he talked to Penny and he said, you know, we should go back to Minneapolis and open up a place that offers the complementary programs to those in health crisis. So that really just capsulizes the origins of Pathways. Mm-hmm. And really for the last 20 plus years, Pathways has been offering one-on-one and group services to those in life-threatening or really severe chronic illness. some with maybe a higher level of emotional distress, but it's really been a lot about the emotional healing of any one of those categories.
Well, and I think one of the things that most people don't necessarily know or appreciate fully about Pathways is the way you've decided to provide those services, that they are offered to people
At no
free,
charge.
for
Correct.
no charge. So tell us a little bit about either of you, why that came to be. Why did Penny and Mike feel that that was important?
Well, at the time, Mike and Penny had made the decision to financially support the organization to the tune of about 1/3 of the budget, which allowed then the participants to come and receive these services at no charge. Now, to get services at no charge, you need to have providers that are willing to volunteer. So the challenge was then, and still remains, to find really high quality providers. So we ensure, to get around that, we make sure that they're licensed and certified. But then we engage them in such a way that they find the provision of services very healing for themselves, and to a certain degree. But by not charging, it allows us then to sort of pass that no charge on to the participants. It's a unique model, one that I think some other organizations have tried to replicate, but fortunately for us, we found it's been a sustainable model.
It has been. Maybe talk to us a little bit about some of the other principles of Pathways. I know that in your work with the board, Maureen, one of the things you've looked at is, what is the ground, as a new board member coming in during this really important transition time in the leadership of the board, you were looking at what are these foundational principles, and you asked a lot of questions about that, as I understand it.
Right. The board, we all feel strongly that the services remain free. And in an economy that's difficult to raise money, and as the Wintons have moved away from funding and now we're looking at more community funding, it's tempting to say, is that free service really so important? It is. The relationship that is created between the provider and the participant or participants is very special. I didn't understand it when I first joined the board. It took me a while to understand, but I can remember my first volunteer dinner. And I sat with a group of volunteers, and I went around the table and we introduced ourselves, and I asked each of them, how long have you been volunteering here? And seriously, I think the shortest amount of time one of those providers had been at Pathways was like 6 or 7 years. There were people that had been there for 10 and 12 years. And I said to them, wow, that is amazing. And some of them go weekly, some a couple times a month, but it's a consistent effort. And they said, oh, you have to understand that, and each of them nodded and felt the same way, that they get as much from giving as the participants get in return. So that's one of the sort of underlying tenets of this organization that is going to remain that way. I don't see that changing.
Great.
It makes us unique. It makes the environment special. Another is that when people enter our doors, we're not there to pity people. Nobody that is ill or is dealing with chronic illness or looking at death wants somebody to say, oh, how sorry they are. That is not what they're there for. So there is a sense of community when you watch a participant and a provider or a small group session that is very much sort of equalizes the playing field. People talk about their healing, talk about their lives in a way that is not, oh, that's what you've got going on, and me, not me. I don't have anything. Everybody is on sort of a healing journey in this group, and that's very apparent when you watch people work together.
Right. So let's talk just for a second, Tim, about, let's make sure that everyone understands what do we mean by these complementary therapies.
Sure.
And the crisis that someone might be in. So if you can just talk for a minute, I know you mentioned several, like yoga and different practices, but I think let's talk just a little bit about what is a complementary therapy and why does it matter?
Well, we often describe when participants come to Pathways the first time, we really help clarify complementary therapies in that we have a myriad of services that we offer all the time, around 50 or 60 different, sort of under the umbrella of mind, body, spirit. But what we're quick to clarify, because oftentimes when I'm out in the public, I might get some comments to the degree that, oh, you're one of those alternative clinics. Well, alternative means do what we espouse, don't do what others may be espousing. Complementary for us means find what it is at Pathways within those 50 or 60 different services or programs, whether they be one-on-one or group programs. Find what it is that resonates with what you're going through physically or spiritually or mentally, whatever it may be for you. And when you find that, let it complement what you're going through outside of Pathways, whether it be primary care or other things that you're working with. Because we're respectful and honor whatever is happening outside of Pathways, so that we sort of then position ourselves as just one piece of that participant's sort of whole person health care approach.
And so this idea of the whole person connects with what you were just talking about, Maureen, around not pitying. So the idea, as I understand what you're saying, is that we all are going to face our death. And these people happen to know that they're in the midst of that very challenge. That's the only thing that distinguishes them from the rest of us.
I might add too that I don't know what percent, maybe Tim knows, but there's a fairly high percentage of the providers that after being there as a participant receiving services that went back and got their license in a particular thing that they thought was helpful. And I don't know if it's a huge percent, but you know, maybe 10% of the people actually come back then. They've been in those shoes. They had the diagnosis. They were lucky and, you know, were able to go and move forward with their lives, and they've gotten these licenses, and now they're able to come back and provide. So I love that part of it too. There's that synergy that is lovely.
And I think
now, while we're talking about this as a Minneapolis-based clinic, one thing I want to get on the table is the people who both provide and receive the services, where do they come from?
We, I would say initially from the greater Twin Cities metro, but we've done a sort of deep enough dive, if you will, to collect some information that we know about 15 to 20% of our participants come from the St. Paul metro. Okay,
great. And so it's Twin Cities wide.
Yep.
If you're just joining us, I'm talking with Tim Thorpe and Maureen Bazinet Beck of Pathways, a healing resource center. So we know that you provide the services primarily for the metro. What kinds of things, we've talked a little bit about how after 20 plus years, you're making kind of a turn from a founder-funded organization and a founding executive director, if you will, to a new direction. Can you talk a little bit about what you want the community to know about where you're going as an organization right now?
So in this transition, the founder is staying very engaged presence-wise. They're just, the strategic business approach, if you will, was always to have the founder stay engaged, but just to sort of taper back the financial support because they both felt that Pathways had enough momentum within the health community that this could take on a life of its own. So there's a very strong momentum still. So to keep with that strategic approach, our goal then is to look for new donors, simple in its premise, maybe take a little bit stronger foundational approach to community foundations that may understand and engage in the type of work we do. It may be at some point to connect peripherally with some healthcare organizations that may see the benefit of sending their patients or constituency to us so that we basically then continue to provide at no cost healthcare options that keep their healthcare needs addressed to a degree, but keeps the overall cost of that healthcare down, obviously, when you're not charging for those services.
Right, which is such a big issue. I understand, too, that you've found some evidence that's important to this transition. You've done some research of your own that you have done?
We had done some internal research, but we wanted to ensure and make sure that the public that we were dealing with looked at it and really understood that this was valid research. So we engaged the University of Arizona Research Initiative, nationally if not internationally known. And to capsulize this, they designed for us a self-assessment scale that allowed us to then quantify the shifts in emotional health from before coming to Pathways to after. And what the University of Arizona told us was that these were statistically significant shifts, whereupon learning this, they told us this is something that the general public and the medical community needs to know about you. So that's what we bring to a lot of the relationships we form.
We're a real data-driven culture, and you have to explain yourself, right? We have to show the numbers. So what were you impressed with when you saw the research, Maureen? How did you see it from more of an outside board perspective?
Well, it's, you know, the way a person is feeling, anybody can imagine getting that phone call and hearing that, you know, your test results aren't so good. The feeling of where do you turn? We all know that, you know, we know the Western approach to medicine. We know that physicians don't hold your hands and talk about feeling. I mean, that's not the system we're in. So where do people go? So to me, and actually to, I think, most people today, maybe not when Pathways started 23 years ago, but in today's world, people understand that the way a person is feeling, their emotional state of being, their spiritual state of being, is absolutely tied to their physical sense of well-being. So our research is looking at that, and as people come, we see that people's just sense of well-being is much improved by attending these various sessions. They feel supported. They feel better, they sleep better, they feel less anxious, all the negative things that you can imagine yourself feeling with a diagnosis, that this is, you know, this is maybe not curing them, but it's certainly making them have a better sense about themselves as they, you know, fight to get physically well.
And it looked to me like we have some charts that we'll show that show really significant, I mean, 100% increase, over 100% increase. Yep. Although I'm not quite sure how you do that, but anyway, big improvements in how they're feeling. And so what are you, how do you think the research will help you, and what do you plan to do next with that?
Well, I think a few things. I think if you're sitting across the table from a potential donor who likes to see things in a quantifiable way, whether it be a personal donor or the grant manager from a foundation, to your earlier point, oftentimes they need to run by the numbers. We don't necessarily need to do that oftentimes internally because we feel it's fairly intuitive. You can see the emotional improvement in health. But the shifts will help quantify and validate that sort of need on the donor's part. So that helps from a foundational perspective. It certainly helps because then they have something to archive, if you will. I think inevitably, though, the medical community at large still relies on the numbers. And when they see something that's affected by the University of Arizona, to whom they are going for the research needs as well, then it's sort of strength in numbers. They can feel much better about the vetting process around, well, who is Pathways and what are the outcomes that they're affecting? Well, now we have that.
Well, and one of the things I was impressed with, you have more than one person from the medical community involved with the organization, but when Greg Platnikoff talked about this concept of his own experience in Japan, as he was checking people out of a program, there were multiple components, and it was, you know, have you cured, but have you also healed? And I never heard anyone quite explain it that way, but it was, but I was so impressed with it from the standpoint, because what you're talking about is we are obsessed now about what's happening, the costs, the medical costs, and so forth. I think what you offer is pretty profound in that you're giving people access to healing, not just being, you know, you're not providing the cure, but you might just provide that cure through that emotional component as well, because the person has a chance to heal on a deeper level.
Yeah, it's interesting. Greg Platnikoff, who is a medical director over at Allina Abbott Northwestern, he's a great example of a strong board member, but B, somebody who helps steer us from outside the four walls of Pathways. Greg has said that from his perspective, given his experience overseas, that no doctor or nurse in training should open a textbook, medical textbook, until they learn how to be present at the bedside. And it's a great example of the advent, I think, of sort of this growing circle of medical professionals who are, as Maureen said earlier, they're figuring out how to sort of connect the facts and the feelings, if you will, to make it sort of a consistent approach to the patient health.
And you know, just in terms of next steps, if someone's watching the show and has a friend, a relative, or they themselves have faced one of these crises, what do you want them to do? You want them to go to the Pathways website? You want them to call? They can get an appointment? What do you want them to know? They could call us, 612-822-9061, or they can go to our website, which is www.pathwaysminneapolis.org. Okay, and we'll put that up on the screen too. Okay. We have an online scheduling system so that if they're a new participant, they can go into the system, they can attend an orientation. Typically, most people are wondering, so what are the programs and how can I get engaged in them? How will they help me? The curtains part a little bit in terms of clarification once they come for the orientation, after which they simply go online and assign themselves a variety of different programs. And I know the programs are in demand, and so they may have to pick and choose among different options. They may only get one of three, but chances are they'll get what they're looking for.
There are actually, Catherine, levels. So a newly diagnosed person, that person that's, you know, feeling panicked and restless,
urgent, I mean.
That's a level 1 person, and we can get them in.
Great.
We look to get them in as quickly as possible and get them into an orientation and, you know, begin talking about what they're feeling and what they need. So.
And one of the things, even though the center is in South Minneapolis, it's easily accessible. It's just in Uptown. It's a beautiful facility and a place to easily get to because you have parking in the back. Correct. Many people feel it's sort of a sanctuary. They can feel the energy and sort of the lower stress level once they enter the building. Oftentimes, not just by design of the building, but the providers really set the tone.
And the staff.
And the staff.
We're very lucky.
And the board. Yeah.
Their staff, we really are.
Well, that's all we have time for.
Okay.
Come back again next week and SPNN. Thanks for joining us.